Nursing assistants. What is mental illness? A mental illness is a disorder that affects a person's mind, causing the person to act in unusual ways, experience emotional difficulties, or both. In many societies and cultures, mental illness is viewed as something to be ashamed of. A mentally ill person's odd behavior may be frightening to those who do not understand it. Mental illness and the role of media. Movies, television, and books have contributed to the popular image of mentally ill people as crazy, violent, out of control. Some people who are mentally ill may behave in a violent or dangerous way, but most do not. There are many different types of mental illness, and mental illness varies in severity from person to person. Mental health. Mental health. Simply put, mental health is the absence of mental illness. One of the main qualities of mental health is a state of emotional balance. Physical health is related to the body's ability to make adjustments to maintain a state of physical balance or homeostasis. Similarly, mental health is characterized by a person's ability to make adjustments to maintain a state of emotional balance. Mental stress. Life events that cause mental stress include getting married, divorced, starting a new job, having a baby, losing a loved one. For most of us, stress is constant in our lives. Physical stress. Stress which results from any change from the normal routine affects a person's ability to maintain a state of balance. Changes that affect us physically, such as illness or disability, cause physical stress. Effects of stress on our system. Stress that is not managed properly can affect a person's physical health as well as his mental health. For example, not being able to manage stress can put a person at risk for cardiovascular problems such as a heart attack, digestive disorders such as ulcers. Stress. How much is too much? Each person has a limit to the amount of stress that he or she can effectively deal with at any given time. Fatigue, illness, and everyday stress sometimes affect our ability to cope with change. Many times, stress does not come from one single source. A person may be able to cope fairly well with one type of stress, such as a loss of a job, but when other stressors, such as a sick child, are added, the person may reach his breaking point. Signs of excessive stress. The person may cry, sleep excessively, or be unable to sleep, have difficulty concentrating, feel depressed for a time. Most people with good mental illness are able to eventually overcome these feelings and regain their emotional balance. Signs of stress. The mentally ill cannot cope effectively with stress and may become unable to work, care for their children, make simple decisions, think clearly, or even provide for their own self-care. A mentally ill person may need medication, counseling, or support groups to help regain emotional balance. Signs of stress. Coping mechanisms. What do you do when you start to feel overwhelmed or stressed out? Over time, people may become to know what they can do for themselves to make themselves feel better when they start to feel overwhelmed by life's pressures. These conscious and deliberate ways of dealing with stress are called coping mechanisms. Many people rely on positive coping mechanisms such as exercise, prayer, meditation, getting together with friends, or engaging in a hobby. Negative coping mechanisms. Other people rely on negative coping mechanisms such as nail biting, pacing, overeating or not eating enough, smoking, abusing drugs, or alcohol. Stress. Initially, these behaviors help the person to reduce stress, but over time they place the person at risk for serious physical problems, mental problems, or both. Positive coping mechanisms. Maintaining a state of emotional balance requires using coping mechanisms to deal with and adjust to stress. Defense mechanisms. Our bodies are programmed to try and return to a state of balance. When a person is under stress, the mind may try to return the person's state of emotional balance by using defense mechanisms. Defense mechanisms are methods of dealing with stress, things that just happen. Usually a person that is not even aware that he or she is using them. Defense mechanisms help to protect us from emotionally traumatic events. a defense mechanism, compensation to help make up for a loss by filling in or substituting something else. For example, a person who feels lonely may eat too much, substitute food for affection. Conversion, changing one thing into another. For example, a person who is depressed by an emotional problem may develop a stomach ache, a physical problem. Denial, refusing to believe something that is true, especially if the truth is unpleasant. For example, a person who has been diagnosed with cancer may truly believe that the doctor has made the wrong diagnosis and that he or she does not have cancer. Displacement, shifting an emotion from one person to another who is less threatening. For example, a resident who is angry with her daughter for moving her to a long-term care facility and who is afraid of expressing this anger because she fears the daughter will abandon her may take her anger out on a nursing assistant instead. Projection is blaming someone else for your own uncomfortable or unacceptable actions or feelings. For example, a resident may accuse a nursing assistant of breaking a vase when in fact the resident actually broke the vase herself. Rationalization, making excuses or creating acceptable reasons for poor behaviors or actions. For example, a student who does not study for a test and then fails it may tell herself that the reason she failed it is because the teacher was too hard. Defense mechanisms. Regression, to turn back to a former or earlier state. For example, an older child who is hospitalized begins to suck his thumb. Repression means the same as suppression. The refusal to remember or to think about a frightening or painful memory. For example, a person who was a victim of a terrible accident or crime may not be able to remember the event. Repression and displacement. Repression, once again, when a person cannot remember what happened several months or years earlier. For example, abuse that occurred as a child, either sexual or physical. Displacement, a defense mechanism, for example, when a woman blames a doctor for causing the death of her husband, when actually the husband had a terminal illness. Question 1. Some stress is necessary to protect us from harm. True or false? True. Stress is the result of any change from the normal routine. For example, the stress of meeting a wild bear on the walking trail will encourage us to react in a way which will protect ourselves. Causes and treatment of mental illness. Causes of mental illness. There are many different types of mental illness and many different causes. In some types of mental illness, they run in families. For instance, they are inherited. Others result from chemical imbalances in the chemicals called neurotransmitters. Some mental illness may be caused by a person's environment. For instance, a person who is abused by a family member may develop ineffective coping or defense mechanisms that lead to mental illness. Treatment of mental illness. The word psychiatric comes from Greek words psyche, the soul, and atria, healing. A psychiatrist is a medical doctor, MD, trained in diagnosing and treating mental illness. He is allowed to prescribe medications. A psychologist, while not a medical doctor, a PhD, has education and training that allows counseling services to help people with mental illness. However, a psychologist is not allowed to prescribe medications. For profound depression, one would seek out professional help from a psychiatrist. Depending on the person's situation, he may need the services of a psychiatrist, a psychologist, or both. With treatment, many people with mental illnesses are able to lead happy, productive lives. Treatment for mental illness dramatically has changed over the last 50 years. In the past, mentally ill people usually were sent to special hospitals called mental institutions, where they were given large doses of medications to keep them quiet and sedated. In the past, techniques such as electroshock therapy, passing electricity through the brain to cause a seizure, and lobotomy, a surgical removal of part of the brain, were used frequently, often with little success. Treatment for mental illness. Now we know more about why mental illness occur and how they should be treated. Medications are used to restore the brain's chemical balance. Rather than simply sedating a person into submission, these new medications help a person to act and think more normally. And electroshock therapy, while still used in some cases, is used much more effectively. Treatment is important because with treatment, many people with mental illness are able to lead happy, productive lives without treatment, they may suffer needlessly and may even be at risk for suicide. Types of mental illness. The more common mental illnesses include anxiety disorders, mood disorders, schizophrenia, substance abuse with addiction, and eating disorders. Schizophrenia, one that has difficulty determining what is real and what is imaginary. Anxiety disorders. Feelings of anxiety can cause many physical symptoms and symptoms such as sleeplessness, restlessness, fatigue, changes in appetite, increased heartbeat and blood pressure, irritability, difficulty thinking. Common anxiety disorder. Common anxiety disorders include panic disorder, obsessive-compulsive disorder, phobias, simple phobias, social phobias, agoraphobia. Anxiety disorder, panic disorder. Panic is a sudden overpowering fright. A person with a panic disorder has terrifying episodes or panic attacks during which she experiences extreme anxiety and feelings of intense fear. Anxiety disorders. Anxiety is a feeling of uneasiness, dread, apprehension, or worry. Anxiety is a normal feeling that we have in response to situations that are threatening to our bodies, lifestyles, values, or loved ones. A certain level of anxiety is normal and may actually lead us to do something positive about a bad or potentially dangerous situation. But too much anxiety or prolonged periods of anxiety can make it hard for us to function or cope with everyday situations. Anxiety disorder, panic disorder. A person who is having a panic attack usually also has physical signs and symptoms such as chest or abdominal pain, a rapid heartbeat, shortness of breath, dizziness. These panic disorder symptoms, for instance, chest pain, may be very similar to those of a heart attack or other severe physical illness. Panic attacks can be very brief or they may last for some time. Anxiety can cause a pounding heart or sleeplessness. Some people will experience these attacks rarely, while others will have them quite often. It is important to remember that even though the physical symptoms may not be a sign of a serious physical condition, they are no less real or frightening to the person who's experiencing them. Obsessive-compulsive disorder. Obsessive-compulsive disorder is an anxiety disorder that causes a person to suffer intensely from a recurrent unwanted thoughts. That's obsessions. The obsessions are usually associated with rituals that a person cannot control, compulsions. The rituals may include such actions as hand washing, counting, checking. Obsessive-compulsive disorder. These rituals are repeated over and over in hopes that the obsessive thoughts will go away. Anxiety, obsessive-compulsive disorder. If you don't perform the rituals, it will increase the person's level of anxiety. When it is severe, obsessive-compulsive disorder takes over the person's life. The person becomes unable to perform the tasks that are associated with normal everyday activities because of the obsessions and compulsions. A phobia is an excessive abnormal fear of an object or situation. Phobias can be incredibly disabling for the person affected by them. The person will do anything to avoid the thing he or she is afraid of, to the point where they may be unable to do something as simple as leaving the house. There are three main groups of phobias: a simple phobia, social phobia, and the third, agoraphobia, which is someone that cannot leave their home for any reason. Anxiety disorder and phobias. Simple phobias are the most common type. A person with a simple phobia is abnormally afraid of a specific thing. For example, dogs, cats, insects, heights, water, flying in an airplane. anxiety disorder. Social phobias involve a fear of being humiliated or embarrassed in front of other people. Social phobias may be related to feelings of inferiority, low self-esteem. Social phobias may cause a person to drop out of school, avoid making friends, remain unemployed. Agoraphobia is the fear of having a panic attack in a place from which there is no easy escape and where help is not available. For example, a person may be intensely afraid of having a panic attack on an elevator or on a crowded bus. PTSD, post-traumatic stress disorder. After experiencing an overwhelming traumatic event, combat, natural disaster, serious injury, criminal assault, rape, death of another person, the symptoms are flashbacks, panic attacks, nightmares, depression, and increased anxiety. Substance abuse and alcohol abuse are common if not treated for PTSD. Mood disorders. Mood disorders can affect how a person feels emotionally. There are common types. Depression is one. Bipolar, which is manic depression, is a feeling of excessive happiness and excitement followed by a feeling of excessive sadness and hope. Mood disorders. Depression is a feeling of excessive sadness or hopelessness. In many events, such as the loss of a loved one, you can have temporary feelings of intense sadness and hopelessness. In a person with good mental health, the painful emotions of an event-related depression go away over time. Sometimes short treatment with medication or counseling may be needed to help a person through the crisis. Depression. Some people, however, experience intense feeling of sadness and hopelessness that does not go away even over time. These feelings may or may not be brought on by a sad event such as death of a loved one. When depression is severe and persistent, it's called clinical depression. It's a chemical imbalance in the brain. Clinical depression is one of the most common mental illnesses. It affects more than 19 million Americans each year. Some research indicates that a family history of clinical depression increases a person's risk of developing this mental illness. Women seem to experience clinical depression about twice as much as men do. Clinical depression is also the most frequently treated mental illness among the elderly people. Several factors can lead to the development of clinical depression, including chemical imbalances in the brain, once again, clinical depression, low self-esteem and poor coping mechanisms, hormonal changes such as those that affect women during pregnancy, menstruation, childbirth, and menopause, and also medications. Signs and symptoms. A person who is depressed loses interest in activities that she usually finds pleasurable or fulfilling, such as eating, working, socializing with friends, pursuing hobbies. The person may feel sad or anxious, or the person may cry frequently. Many people who are depressed have problems with sleeping. The person may sleep too much or may not sleep enough. The person may be restless or irritable. Instead of being grateful when someone tries to help them, the person may become angry and defensive. The person may have feelings of guilt and worthlessness. The person may struggle with thoughts of death or suicide. The person diagnosed with clinical depression is at risk for suicide and is due to a chemical imbalance in the brain. Physical complaints such as pain, digestive disorders, and also common in people who are depressed. Prompt treatment is needed to help clinically depressed persons return to an enjoyable, productive life. Depression and the older person. The incidence of depression increases with age. Elderly people are less likely to seek treatment for this disorder. Many older people who are depressed feel that their depression is just part of getting older, but this is not true. If you will be working with older patients or residents, pay attention to changes in their behaviors or moods that may indicate clinical depression. By reporting these observations to the nurse, you play an important role in helping to ensure that the person receives treatment that will help him feel better. Bipolar disorder, manic depression, is a mental illness disorder that causes mood swings, periods of excessive happiness and excitement that may cause a person to engage in impulsive or reckless behavior, mania, are followed by periods of excessive sadness and hopelessness, depression. Experts believe that the bipolar disorder is caused by chemical imbalances in the brain that affect a person's moods. Schizophrenia can be a very disabling form of mental illness. It tends to run in families and may have a genetic basis. Schizophrenia may be mild or severe. A person with severe schizophrenia that is untreated may be in danger of himself or to others. Schizophrenia. A person with schizophrenia has trouble determining what is real and what is imaginary. He may suffer from delusions or false ideas. For example, the person may believe that he or she is someone famous, or that someone is spying on him, or that someone is trying to steal his or her belongings. Schizophrenia. A person may experience hallucination or episodes where he or she sees, hears, feels, smells, or tastes something that is not there. For example, a person that hallucinates may hear voices in his head telling him to perform a certain act, possibly kill another person. In schizophrenia, the person's thinking and speech becomes disordered. He or she may switch from one topic to another during a conversation. He may make up new words or patterns of speech. The person may say or do something very strange, making it hard for him to function in social. Substance abuse disorders and addiction. Substance abuse disorders and addictions involve excessive or inappropriate use of drugs, prescription and recreational, alcohol, or inhalants. They can develop a physical dependency, and you can experience physical tremors, delirium, and emotional anxiety effects. Substance abuse disorders and addiction. Addiction is a physical need for a substance that results in withdrawal signs and symptoms when you quit taking the substance. Withdrawal is an emotional and physical reaction that occurs when the use is discontinued. Alcohol most often is abused by older people. Withdrawal signs and symptoms depend on the substance and how frequently it's used and how much is consumed. Withdrawal signs and symptoms: body tremors, changes in mood, delirium, hallucinations, nausea, vomiting, sweating. Eating disorders. The most commonly known eating disorders are called anorexia nervosa, bulimia nervosa, which is excessive vomiting or laxative use, and binge eating. All eating disorders involve serious and potentially fatal changes in eating behavior, such as reducing the amount of food eaten to almost nothing or severe overeating. Eating disorders can cause many physical problems, including kidney failure and serious heart problems that can lead to death. Like people with other mental illnesses, people with eating disorders cannot voluntarily control their impulses, and they need treatment to help them learn to eat normally again. Eating disorders usually start during adolescence or early adulthood. Women are higher risk than men for developing an eating disorder. Many people who suffer from depression or anxiety disorders also suffer from eating disorders. People with anorexia nervosa see themselves as very overweight, even though they are excessively thin. Anorexia, which is a loss of appetite, is a key feature of this disorder. The person simply does not eat enough food. She will skip meals, take tiny portions at a time, or make excuses for why she cannot eat. She may allow herself to eat only small amounts of very safe, low-calorie foods. Many people with anorexia nervosa exercise excessively. Bulimia nervosa. A person with bulimia nervosa regularly eats huge amounts of food, binging, and then they induce vomiting or use laxatives to get rid of the body's food before it's digested. They purge. A person with bulimia nervosa often is of normal weight for her age and height. A person with bulimia nervosa is extremely focused on her body, weight, and shape and believes that she is excessively overweight. Binge eating. A person who binge eats will eat large amounts of food without purging. The need to continue eating is excessive. The person will become obese. A person who binge eats may develop various weight-related health disorders such as cardiovascular disease, diabetes, and hypertension. Question 2. True or false? The majority of mental illnesses are untreatable, and these patients or residents are placed in special homes to protect themselves. Answer: false. Many mental illnesses, just like physical illnesses, can be successfully managed with medicines, psychiatric counseling, or both. Caring for a person with mental illness. Treatment facilities for people with mental health disorders differ in purpose. Some facilities provide a form of long-term care for mentally ill people who cannot function on their own and need assistance with activities of daily living, ADLs, and safety. Other facilities specialize in acute care services and provide care to a person who is experiencing a mental crisis that may result in attempted suicide, drug overdose, danger to others. After the crisis phase has passed, the person may be able to return home and receive treatment on an outpatient basis. Treatment facilities for the mentally ill. Outpatient mental illness clinics see people on a regular basis and can offer services such as counseling, medication, support groups. They may even help a person to obtain an education, job training, and employment. Even if you choose to work in a facility that does not specifically care for people with mental illness, you may care for people who have or develop mental illness. Think about the stresses of a person in the healthcare facility and what they experience. He may have fears of being disabled or disfigured from an illness or injury. He is separated from loved ones in an unfamiliar place. He may be worried about the loss of a job and income. He may be worried about his current and future health. Any of these additional stressors can push a person toward mental illness if he has poor or ineffective coping mechanisms. Elderly people are particularly at risk for mental illness. They face the loss of spouses, friends, and sometimes children, often within a short period of time. They face retirement, which can lead to a loss of structure, routine, and sense of identity that their jobs gave them. They may face worries about money, especially if they are living on a fixed income. They may face the loss of physical abilities and independence, either as a result of an illness or the normal aging process. They may feel that they are a burden to their families. They may fear the need to move to a long-term facility because of the associated loss of independence. Listening and your observation skills are very important when you care for a person with mental illness. Be aware of the comments or actions that may indicate a person is thinking about suicide and report your observations immediately to the nurse. When you notice a change in a person's or resident's behavior or mental status and report the change to the nurse, you are taking the first step toward making sure a person gets the help that he needs. The healthcare team will work to determine the cause of the person's change in behavior, which will lead to prompt treatment. Concerns in long-term care. In an older person, a physical problem can cause behavior that may be similar to that seen in people with mental illness. Never just assume that your elderly person or patient is just entering his second childhood or becoming senile. The person may have a serious mental or physical problem that needs to be treated. Concerns for long-term care. Examples of physical problems can cause an elderly person to appear mentally ill can include nervous system disorders, kidney disorders, chronic illness such as hypertension and diabetes, hypothyroidism, anemia, early signs of dementia, infections, dehydration. Side effects of many medications can also cause the person to appear as if they have a mental illness. If you work in a facility that specializes in caring for the mentally ill people, special methods of recording and reporting may be used. Know what is expected of you and how to report and record according to your facility policy. When reporting and recording subjective information about patients and residents with mental illnesses, be careful to use the person's own words and avoid adding your own opinions or judgments. Certain phrases or words may have special meaning for a particular person. To accurately gauge the person's mental status, the healthcare team will need to know exactly what the person said. Tell a nurse various signs and symptoms which should be reported to the nurse. For instance, change in appetite, sleep pattern, restlessness, inability to concentrate, crying, for long periods or frequently, loss of interest in daily activities, loss of interest in socializing. Tell a nurse signs and symptoms, for instance, the inability to focus during a conversation or unwillingness to make conversation. If they have an unusual mood or behavior changes, fatigue, irritability. Tell your nurse if there's expressions or feelings of hopelessness or helplessness, and if there's any expressions for a desire to die. Assisting with activities of daily living. Mental illness may affect a person's ability to eat, sleep, rest, or manage routine, grooming, and hygiene. People with mental illnesses will need different levels of assistance with their ADLs depending on the severity of their disorders. Promote independence. Always help to promote the person's independence by allowing the person to provide as much of his own self-care as possible. Some mental illnesses affect a person's ability to think through the steps of routine care. You may need to gently remind the person what steps come next. Question, true or false? Usually if an individual has not developed a mental illness by the time they are elderly, then they will not develop one at all. Answer, false. The unique losses and challenges that face the elderly may trigger a mental illness. For example, clinical depression is very common among the elderly. The end.